Hello. So today I will be guiding you into showing the demo of our website. So here, this was from before. I tried it out again, just one more time. So I'll be leading you into showing the functionality of our chronic kidney disease early insight. So basically, everything was saved within the member one EGFR prototype branch of the GitHub. The main idea or the intention was to merge everything within the main branch, but there were some issues with that, especially since merging with other member branches did not work out. But so overall, this is exactly how I do it. So first off, of course, you have to be within this branch. I am member one, so this is my branch. And then within this branch, I already ran the tests for um, basically to ensure that everything's working out. So this is the keyword. I run it. Oh, wait a second. I think there was an issue. Okay, so yeah, that's the correct command. It was a typo. Okay, so I run that. I get all my tests. This is just to make sure that everything's running. All the tests that I have passed in. These are the tests I have. There's multiple ones. It tests the API. It tests the care gap because it's one of the main things that focuses upon our project. Basically, deciding whether there's any gap in the care of um, the patient, what exactly can be done to ensure that the patient gets the uh, gets the care needed before his situation deteriorates or like that person's deteriorates regarding chronic disease, especially since the disease goes undetected most of the time, and once it's in its last stages, it's very difficult to deal with it. So right there we have the test EGFR. EGFR is the algorithm that basically is used to detect whether the patient is at risk of getting it. So that's the calculator, and this is also some other tests. So right now it's running the tests. Yes, so the session started. It's just loading. It takes a bit. Yes. So all the tests passed. Okay. Now this like you could do it multiple times, but it's just nice to see it just to clear out all the data once you have everything ready. So I did this. Now this is the main important part. So this right here is going to load the API. This command does it. So I run that. Okay, let me just let it finish loading to ensure everything's perfect. It takes a minute. Come on. Okay, so this is telling me that everything is good to go. So right here, I'm going to press Control click. Control click. Okay, yes. So once I press it, then the server loads. So right here, as you can see, this is the site. So CKD Early Insight, Clinical Review Support for Kidney Function, and many other screenings and awareness that is done. This tells you what is included in the review. It tells you the calculation to test whether the kidney is in good function. Also, some screening, the current level of concern, recommended next step guidance. So this shows you that the purpose of this is designed to help clinicians review key kidney-related findings quickly in a clear and organized format. So obviously, this site is designed for the doctor to be the user, and it shows you everything here. So right when you come up here, you have to open the patient record. So you place in the patient's ID. So this is one of the IDs of the patient, as according to the basically the data set. So I'm going to open it. Once I open it, this is what shows up. So it shows you the patient ID, the age, the sex of the individual, the EGFR, so estimated filtration, that's the calculation algorithm, the stage, so it shows you the stage of the kidney function. This patient did not have the albuminuria screening done, so it shows unknown. And here it gives you a detailed clinical summary. So the current interpretation, the kidney is currently in a severely reduced range, requires pump review. Diabetes also something that the patient has. This may increase the kidney concern. Um, yes, the urine albumin screening gap is identified, should be addressed as a follow-up review. And it shows the recommended follow-up. So repeat the kidney function review, confirm current stage, obtain urine albumin to carnitine follow-up testing, and then shows you the population context. So this shows you the percentile of the patient. So here is the kidney-related measurements. So it shows you the most important, basically measurements needed for chronic kidney disease. It gives you a reference. So this shows you the ideal ranges. It shows you the result, the status, and the interpretation. So as you can see, it's elevated, meaning that this patient is at a severely high risk of developing it or even has it. So this shows you the overall patient summary. So if you go here to the open concern here, concern status, it tells you exactly the estimated level. So it shows you here higher current level of kidney related concern, estimated of 91.5%. Um, this summary should be reviewed together with the patient's history, laboratory findings, and follow up needs. High chronic kidney disease concern. EGFR is below the CKD threshold. He has diabetes and urine screening gap. So here's some visuals that the doctor can also look into. So it shows you here a comparison of the patient's EGFR with the available reference average. So it shows this and it shows the overall reference. And it also he shows here the visual summary of the patient's current kidney filtration level, which is very low. So there's also some supporting clinical review details additional to the summary. So his age and diabetes, different types of blood pressure. This is diabetes, diastolic and the systolic. His age, the serum creatinine, urine album. So it basically gives the doctor a better idea of whether the patient is at risk of developing uh, chronic kidney disease, and is very useful because, as I said before, this disease oftentimes, most of the time, is only detected in the later stages just because of normal human conditions. So doctors are overwhelmed with patient care, and they're not really able to see everything at once. But if they log into this dashboard, and this dashboard is tailored and focused upon chronic kidney disease, then they could see it in the early stages. So if I were to use another patient, so let's say there's another patient record that I can do. So I open the record, and now it gives me different. So it shows that he is in the early stage. His kidney function looks good. The estimated filtration looks also a good amount. He's 61. He's a male. It shows here it's currently above the main chronic kidney disease threshold, so that means he's good to go. He has diabetes, which could increase kidney related concern, but overall his filtration levels are good. No immediate urine screening gap is identified, so that shows everything's good to go. Continue routine monitoring as appropriate, and he's part of the 44.9 percentile, so about 45 percentile. And as you can see here, the same thing, the reference, the result for each laboratory value for kidney related measurements, everything is within range, which is a good sign. So if you look here in the more detailed reference, So here it says he has an estimated level of 13.6% concern of developing chronic kidney disease. He does have diabetes, which is something to always follow up with, but he is right now currently at a low concerned. As you can see, the reference average is 99.5 and he's around 97.83, which is good. And this shows the overall filtration. So overall, this shows that everything is good to go. And these are basically how the website works with two patients using two different examples, one that is at an increased risk and at low risk. Thank you.